Good afternoon and welcome to our OPEA conversation regarding the basis of long-term care insurance or long-term care issues as well. My name is John Green with Association Member Benefits Advisors. Thank you for joining us today. Just a couple of quick reminders. All participants are in a listen-only mode, and that means that if you've got questions or you want to chat, drop it into chat or Q&A, and we will answer those questions either specifically back to you if it's something specific to your issue, or if it's something the whole group can benefit from, we will then answer it that way as well. We do record all of these sessions. We put them out on the OPEA website so that you can follow up and review them later as well. I'd highly encourage you to do that later, especially as we get closer to the holidays. This is an excellent topic for you to review with your family members and discuss about yourself, about your parents, before something actually happens as well. You'll also notice this QR code on the bottom of the screen here. If you've got any questions that that you have, you can drop those in there, and by using that QR code and be able to get response back, and we can help you address those issues that are out there right now as well. So just a quick reminder, my name is John Green with Association Member Benefits Advisors. I live a little bit north of Houston. We work with OPEA in providing benefits and education for members. And we have with us today one of the representatives, the legal legislative liaison for OPEA, and that's Chanson Flick. Good morning, Chanson. You look pretty sharp there. You've been on the Capitol today, huh?
Yeah, they had a couple of interim studies that were going on today regarding insurance benefits for retirees, and additionally just professional licensing. So we've been over there trying to keep an eye on those and making sure we're keeping all the members up and informed on what's going on over with the legislative bodies.
Okay, I know early voting probably starts next week in Oklahoma. Is that correct?
Yeah, so early voting will end up starting next, I believe it'll end up being Thursday and Friday, as well as Saturday morning of next week.
Okay, and then if you follow OPEA on Facebook, I've noticed there's a lot of candidate suggestions, things like that out there. Is that the best way to get a background on who OPEA
Yeah, absolutely.
is?
And additionally, you can contact the office and ask for me, and I'll be more than glad to fill you in on what decisions were made on why we endorsed the folks that we did and why we really believe that they are the best choices that we have out there.
Okay, one last question, because I know you may have to get back to the Capitol. Are there any hot pressing issues that are coming up in this election that people need to be aware of going into the next legislative session?
Nothing in particular right now. The one big question that was kind of rattling most of the overall state population right now was the recreational marijuana question. The governor did finally set a statewide election on that. It'll be in March of next year. So that's kind of been the big question that's been rattling around. Other than that, we're looking at all the same standard issues that we're coming across. Inflation, healthcare, those are going to be the biggest issues that we have coming up.
Absolutely. All right. Thank you very much. Continue to fight the fight on behalf of Oklahoma public employees and retirees. Thank you for what you do, Chanson.
Absolutely. Thank you, sir.
If you need anything, go out to that OPEA website and you can find out the best ways to get involved, but check out their Facebook page as well. Just a quick reminder on what OPEA does for you. They're looking out for not only your benefits, pay raises, workplace adverse action issues, things like that, but for those of you who are working or already retired, looking out for your pension as well. Those are things that you have worked all your career for, and you can't outlive your pension, but making sure you've got a strong pension is so crucial. OPEA does that on your behalf. They keep you connected to your local community, even if you're in major metropolitan areas in Oklahoma or scattered all the way out in the rural areas. Keeping you connected with like-minded state public employees as well as retirees is one of the ultimate goals of OPEA, and getting together for conventions and things like that. And then helping you gain access to important benefits, exclusive discounts, free things like that that can really make your career or your retirement years even more fulfilling for you. At AMBA, or Association Member Benefits Advisors, we serve associations all across the country for over 40 years. We're based out of Austin, but we are proud to work with the Oklahoma Retired Educators Association, as well as the Oklahoma Public Employees Association. David Moritz is our leader up in Edmond. He and his team are all across the state, able to help you with any questions. Their background is that they study your state active and retiree benefits. They understand your pension plan. They understand how all that works in with Social Security and Medicare and all that kind of stuff like that. so that you can make sure you've got the best, most informed decisions on your benefits and on your peace of mind issues. And some of the things we're going to talk about today that related to peace of mind. But one of the benefits of having OPEA and AMBA together is it can fill those gaps that the state doesn't provide in your benefits. You've got some pretty wide array of options with your state plans, but there are some certain things that aren't covered in your state plans, whether you're a retiree or an active employee. OPEA and AMBA together can help you do that and cover those gaps. They're portable if you leave state employment for whatever reason, whether you retire and move out of state, whether you go to the private sector and then come back, something like that. You can take these benefits with you, no matter if you're a state employee active or not. But the biggest reason that many OPEA members tell us they appreciate these benefits is because they can extend access to these benefits to their adult children who have maybe aged out of their state benefits because they've reached age 26 and they're no longer eligible, or for their parents who were never eligible for any of their benefits, but you can provide access to those benefits for them that may prevent you from having to cut your career short, take additional extended periods of time off because you're taking care of your parents. So that's a real benefit today, especially the topic at hand today that we're going to talk about. So we want to talk about today this whole concept surrounding elder care, long-term care, discuss the need for it depending upon your age and the situation, the facts and myths around this. And we hear this quite frequently. So many people think that, well, I can get long-term care this way through Medicare, Medicaid, things like that. We're going to discuss the traditional components of long-term care. We're going to show you some specific Oklahoma cost issues, things like that, and help you make the most of your endorsed options that are out there for you. So let's jump right on in here. And the reason why I share this, it's a very personal situation to me. This is a photograph of me and my father in July of 2020 when he turned 80. He was in a memory care facility in Austin, and he had just been transferred there from a nursing home facility in Marble Falls outside of Austin after about 18 months. Results of complications due to vascular dementia. And this was the last time that my father remembered who I was. But I was so appreciative of what my father had done up to this point to take care of his family and provide for his care if he ever did have a situation that he needed long-term care. My father ran track for the University of Oklahoma, was the most healthy individual that I ever knew, played basketball well into his 60s competitively, was all state in track, football, basketball in his high school career. But strokes affected him and then led to vascular dementia that changed this man to someone I didn't know. But because he had prepared, my stepmother, my brother, and I did not have to worry about the quality of his care. And so this conversation we're going to have today is peppered in with my personal experiences. It's why I'm passionate about this subject. It's why I feel it's a discussion you should have with your family members, whether you're the parent with your children, whether you're your brothers and sisters regarding your parents. You need to have this discussion because it can make or break a family financially, emotionally as well. So we're going to talk about this whole concept of protecting your future through long-term care coverage, what that means, is there a need for it, what is and isn't covered by Medicare as well. I want you to take a quick quiz. If you'll grab a pen real quickly, I want you to just take a quick true or false quiz. True or false, long-term disability and long-term care are the same thing. Very few people really ever need extended long-term care, and really only people over 50 need some type of long-term care. True or false, nursing home confinement is the only type of way that you can get long-term care. Medicare pays for everything, and I should just wait until I'm retired. Now, I'm not sure if we've got a mix of retirees and active employees on here that are joining us on their lunch hour, but every one of these questions here is false. If you are an active employee and you have a long-term disability plan through the state, that's not the same as long-term care. Long-term disability is ensuring your paycheck income. Long-term care provides for your care if you have some type of extended illness or a chronic illness or a condition you're not going to improve from. We're going to walk through and kind of address the myths and all of the rest of this as we go through this conversation today. Just know that there's a lot of myths around this, and I want to see if I can address those for you. If you've got questions, feel free to drop them into chat and Q&A. We can answer those as we go along here. The fact is that 70% of us, once we reach age 65 or beyond, are going to need some form of extended care at some point in our life. And we're going to talk about that. It could be related to a fall. It could be related to a cancer, a heart attack, or a stroke situation, or it could be something chronic like my father's dementia that caused him to need extended periods of care. And it may not be that you have to be like my father and spend the last 2 years of his life in a nursing facility. It could be for 3 months, 6 months, something shorter as well. But the fact is, the overwhelming number of us are going to need that. And it varies depending upon our age, depending upon our sex, depending upon our medical history. But here are some of the current realities in long-term care. 28 months, a little over 2 years, is the average amount of time that someone stays in an assisted living facility. An assisted living facility is kind of that, I want to call it a halfway house, but it's that midway point between your home and a nursing home, where you have an apartment and you have access to the meals, the activities, maybe somebody that can come in and check in on you, give you some medication, maybe do light housekeeping, things like that. 28 months is the average time someone stays in an assisted living facility or a community, but almost 60% of the people who start there will end up moving into a skilled nursing facility, what we consider a nursing home. So the overwhelming majority that will go to an assisted living facility will come into a skilled nursing facility. The average length of stay is a little over 2 years in a nursing facility. However, if you've got Alzheimer's, that could be on average 9 years of a stay there. In the first facility that my father stayed in outside in Marble Falls, outside of Austin, I noticed that I get to know some of the patients. I get to talk to some of the people that work there, and I'd ask about certain residents there, and they'd say they've had Alzheimer's or they have Alzheimer's. They've been here for 6, 7, 8 years. So if you've got a history of Alzheimer's, you may want to consider some type of plan that covers you for a longer period of time. Men will stay less time in a nursing facility than women on average. My father stayed a little less than 2 years. Women stay longer. Usually this is because men will stay at home as long as possible because their wife does not want them to move into a nursing home. And then they go to a nursing home in the very last few months of their life. Women will wear themselves out and then go into a nursing home at that point. But the stat that shocked me after looking at all these resources, government numbers, general private numbers out there as well, is that 47% of nursing home residents stay less than 100 days. And I want you to write down that number 100 and just keep that beside there, because that number 100 is very important. And it's not because most people pass away within 100 days of going to a nursing home. I'll tell you why about that in a moment. So write that number 100 down. So some of you may have had long-term care policy in the past. Your parents may have one. The state does not offer a long-term care plan. Many states don't offer it anymore. And that's simply because it's difficult to qualify for. It costs a lot of money out there. But the traditional components of a long-term care plan, we're going to build it kind of like a good hamburger. That if you build a good hamburger, you've got a good meal. We're going to build a good long-term care plan. So most long-term care plans all have a qualification. And to be a hamburger, you've got to have a bun. That makes what makes it a hamburger. A hamburger without a bun is basically just a patty melt or just a chopped steak. But a long-term care policy, to trigger it, you have to lose an activity of daily living. Bathing, toileting, being able to wipe your backside, dressing, feeding, transferring, meaning getting out of the bathroom, out of the tub or out of bed into a chair, something like that. Those are activities of daily living. If you have a long-term care plan, you have to usually lose 2 or 3 of those activities of daily living to qualify to activate your plan. Or, like in the case of my father's situation, it's a cognitive impairment like dementia or Alzheimer's. If you're diagnosed with that, then the plan starts to pay at that point. in the early stages of my father's dementia, he could do all of those activities of daily living, but he was at risk to run off, to get up in the middle of the night, to become an electrician that he had no training for, just, strange things like that. So it's either a cognitive impairment or an activity of daily living that you lose that triggers your benefits. And your benefits, the meat of the policy, or the daily benefit amount that the policy says we'll pay $200 a day, $300 a day, or a pool of money that says you have $100,000 that you can pull from to use for your long-term care. Some traditional plans would cover 2 years, 5 years, or lifetime maximum. The type of plan my father had covered him for his entire life. No matter how long he needed it, it paid a fixed daily amount every day to the nursing home facility for as long as he was alive. It covered him that way. Then you have an elimination period. And this works kind of like a deductible on your homeowner's insurance. This is a deductible on your long-term care policy. And those of you in Oklahoma know you're in Tornado Alley, that your homeowner's insurance policy has a deductible that may be 1-2% of your home value if a hailstorm or a tornado rolls through, that you'll have to pay out of your pocket before your insurance kicks in. The elimination period works the same way in a long-term care policy. It's the first 30, 60, 90 days that you have a cognitive impairment or lose activities of daily living that you have to pay out of your pocket for the nursing facility before the plan kicks in. It's really a way that most people keep the cost down on these policies, but I want to show you some alternatives here in a moment. And then you come in and you're starting to put in some condiments on top of your long-term care plan that can vary based on the type of plan you may have or what your needs are. Some have very specific requirements or definitions of location of coverage, meaning that you can only get coverage if you go to a nursing home, or you get reduced coverage if you have your care provided at home. So there's changes there. So you may want to look at that. Some have inflation protection on it. So if you took a policy out 2 or 3 decades ago, that now you need to claim on it, that coverage has gone up with inflation. And so some policies have this, some policies have later triggers in the policy that will allow you to activate those provisions. It's important to have an understanding of what those are, because it can really leave you with the right amount of coverage that you have or not enough coverage that you think you need based on what your requirements are. And then a biggie that most people don't realize that they don't have is what's called non-skilled services. And this is to have someone come to your home to cook and clean, maybe do some light housekeeping. In the case of my father, to stay up at night, because my stepmother still worked, but there needed to be somebody that would stay up to make sure that my father wasn't a flight risk. Certain plans cover that, certain plans don't. So those are some historical, traditional components of a long-term care plan. And if you have a plan, I highly encourage you to review it, get someone to review it for you so that you can make sure that you know what you have, because what you may have purchased before may not fit what you need today. But when we talk about long-term care, it's really this whole overall concept of extended care. It's not only care in a nursing home facility or a long-term care facility like we think of, like my father had to go into for a couple of years. It could be care in your home. And most people want to be cared for in their home because they're familiar with their surroundings. They want to stay close to a loved one. Or it could be care in an assisted living community where you can go in and, like I mentioned, take advantage of all the activities that they have and the meals and someone to check on them. But as you progress in your need for care, they have a doctor on site or a physical therapist on site. You've got that ability. And we're seeing more and more of these care communities centered around fraternal organizations or religious organizations. There are even some communities in Texas that are for retired teachers. So there's different type of organizations, sometimes like your Shriners or your Optimist Club, things like that. There are communities for those individuals as well, Scottish Rite, stuff like that. So you've got different options that are out there. So when we talk about extended care, we talk about all those options together, just so that you've got a heads up on that. And just as there are many options to receive extended care, there are many ways to pay for that. Personal savings or assets, things that you've saved up for, using it for that. Oftentimes assistance from family and friends. And we're going to talk about that in a little bit greater detail as we go forward. Some people talk about entering the Medicaid program. We'll address that. And then there's the whole concept of having a coverage, a plan that pays for your extended care as you go forward there. And you never know who needs this. My father was in his 70s, late 70s, when he went into the nursing home. He started showing signs of dementia in his mid to late 60s. Whenever he went into his first facility in Marble Falls, I noticed that there were many people in there who were younger than me, and I was in my early 50s when my dad went in. And I would ask some of the aides there, some of the nurses, what happened? What's the situation? And it would be they were in a car accident, or they had a fall and had a traumatic brain injury. So, you think about, as we age, it's harder to do things than what we used to, but then younger situations, younger individuals may need extended care as well. So we don't know what that future holds. That's why having a good plan or knowing what you're going to do is so important out there. And the common myth that we see all the time is that, oh, my health insurance is going to cover it. I've got TRICARE, or I've got the state plan, or I've got state retiree medical, or Medicare is going to cover my long-term care costs. I can tell you, in both situations, Medicare and health insurance don't provide for any form of significant extended care coverage, especially if you become where you're no longer going to get better, if that makes sense, that you're not going to improve. You're always going to be in this condition, or your condition is going to worsen. And I'll show you that in just a moment as we go through there. And then some people confuse Medicare with Medicaid, two totally different programs, two totally different situations, and we'll address that as we go through here. We talked a little bit about extended care, what it is. The most important thing to me was, you work your whole career, or your parents worked their whole career. Why do you want to have someone else determine how you're going to be provided for if you need it? We tried to keep my father at home as long as possible. That was our goal. We were able to do that for a good period of time, until my stepmother could no longer safely provide for him and take care of him. But care doesn't mean that you have to go to a nursing home. Don't have to go to some type of memory care facility. It can be in your home, in a community of like-minded individuals, assisted living facility, or if necessary, in that nursing home. But you have control when you have a plan. But let's look at the cost of that plan. People may want to have a home health aide come out. They may want to go to an assisted living facility, or have a semi-private or a private room in a nursing home. These are some national costs that Mutual of Omaha, who is one of the biggest providers of long-term care, puts out there. Those individuals, they survey nursing homes and care providers all across the country. $25 an hour for a home health aide to come out to your home to take care of you in the home. Almost $6,000 a month in assisted living facility. $250 a day in a semi-private room for a nursing home, and close to $300 a day for a semi-private or for a private room in a nursing home. Those costs are pretty high. Good news is, in Oklahoma, it's a little less expensive than that. The bad news is, just this past year, it has gone up dramatically. And there's a couple of reasons why it's gone up there, but you can see these numbers. I kind of ran them, major metropolitan areas, both in Oklahoma City and Tulsa, Durant, a little bit more rural out there. I encourage you to write down genworth.com, genwrth.com, and you can go out there and play with their cost of care widget. You can plug in a zip code, you can put a city in, whatever you want to, and it will tell you how much it costs for that home health aide to come out, how much it costs for an assisted living facility, apartment, single occupancy, semi-private versus private nursing home. And you can see these rates have gone up just in this past year, due to inflation, due to COVID. Lots of different requirements have changed for different nursing facilities, things like that. So again, knowing what your costs are going in could be of huge importance, because there's a lot of reasons why people have to go in. There's even more ways they have to pay for it, and you've got a plan to do that. So Mutual of Omaha is the endorsed provider by OPEA, And at AMBA, we research all of these companies to make sure that they're some of the strongest, best claims paying ability, easiest to qualify for, things like that. But they give me some stats, and these are stats for 2021. They don't have the 2022 numbers yet. The average age that somebody goes on claim is 78 years of age. Women by far are bigger long-term care users than men. And that's usually because they keep the man at home and they wear themselves out, and then they have to go into a nursing home facility or need long-term care at that point. But the top three reasons for care is what kind of jumped out at me. Dementia, like my father had, that's the biggie. Heart disease, where they can no longer breathe, no longer move as a result of chronic heart disease. But arthritis was a surprise for me. So if you're a very active individual or have a physically demanding job, you might want to consider what your plans are for the future, because arthritis can really can wreck you financially if you need the long-term care. And how you pay is really the biggest challenge here. Oftentimes you may have saved up through a 401k, 403b, 457 type plan through the state. You've got your pension. You can't call the pension board and say, hey, double my pension because I'm going into a nursing home facility. And so oftentimes that first dollar is the most difficult. You may have to sell some assets or pull out of an IRA, and maybe you don't want to take the tax consequences on that, or you don't want to sell it in a down market like we're in right now, because you could really stunt your future earnings. Or we see this in all throughout Texas, Oklahoma, up into the Midwest. We see lots of people that have family land and assets. And to take care of mom or dad, they've got to go around the table and say, all right, we're going to have to sell some acreage. We're going to have to sell this place that's been in the family forever just to provide for mom or dad. That expense can be emotionally draining, not to mention financially draining. Some people say, hey, we'll just put it on Medicaid. We'll just spend all of mom and dad's assets down and we'll hide all that money and sell their house and all that kind of stuff. Medicaid is truly a last resort situation for individuals with limited assets. I will tell you, for most individuals who are OPEA members, state employees, or retirees, if you have a pension, you're not going to qualify because they count that pension as part of your assets. And you sure don't want to assign that pension over to somebody else just to qualify for Medicaid. Medicaid requires you to spend your assets down, as I mentioned, to qualify. They have a look back per year situation where they'll go back 5 years or so and look at your assets. And then even if you do qualify, once you pass away, the state of Oklahoma is going to go back and seek reimbursement from your estate after you pass away to cover anything they've paid. Medicaid is usually not a good situation that you want to be involved in when it comes to long-term care. And so what it boils down to is, if people haven't planned, long-term care usually falls upon the family to take care of the loved one. The stat here that 73% of all long-term care is provided in a home by an informal caregiver who receives no compensation is spot on the money. Most of the time we see, if something happens to mom, the brothers and sisters sit around the table and they say, we have to do something to take care of mom. Who's going to quit their job? Who's mom moving in with? What sister-in-law, daughter-in-law is going to take care of this situation? That means that person who is working, it could be you if you're an active state employee, you're going to have to stop working. You're going to stunt your earning potential for you and your family, or worse even, you're going to stunt your pension in the future because you're going to have less years that you're working. And it really affects women far more than men, because women are more likely to be the caregivers for a loved one. It can affect them to the tune of over $300,000 in their career, in their lifetime. I have seen long-term care situations that have caused divorces because you've got to take care of a loved one that you can't provide for your family. That can mess up holiday periods, lots of other things as well. So again, decisions we make on our care for ourselves or for our loved one can go multi-generations deep, more than just the financial cost of it. So that's why I highly encourage you to look into something like that can make sure you've got peace of mind for your family. So let's address Medicare, because there's this misconception that Medicare pays for long-term care. And remember, I asked you to write down the number 100. We're going to reference that in just a second. Medicare is not designed to pay for long-term care beyond very acute and specific situations. Say you have a fall. First freeze comes through, you fall on the stairs, you break your hip, you've got to go into the hospital, and you stay in the hospital for 3 days as an inpatient. After you come out of the hospital, you can go to a skilled nursing facility to help get you back on your feet, to learn to walk again, to transfer, to dress yourself. Medicare is going to pay 100% of that cost for the first 20 days. After that, you're going to pay $200 a day towards your care if you're on Medicare. After 100 days, Medicare stops paying whatsoever. Doesn't matter. And you're 100% responsible at that point. I told you that 100 days, that stat that said that over 40% of people stay less than 100 days in a nursing home. It's because if they're on Medicare, Medicare stops paying and they can no longer afford to stay in that nursing home. So it's very important to understand if you're on Medicare, your parents are on Medicare, there are very limited coverage for any type of skilled nursing care, and it's only related to an inpatient hospital stay. And this is why Medicare has been making cuts, and they reclassify procedures, medical procedures. All of them are simply billing codes. They will take them from an inpatient billing code to an observation or an outpatient billing code. And all that means is you're going to get the same care in the hospital if you're on Medicare. You're going to get the same care in the hospital. You may spend 3 nights in the hospital, but if that procedure, that knee replacement procedure, that hip replacement procedure, even a spinal surgery is considered an outpatient or observation status, you don't receive any of those benefits related to skilled nursing care once you get out of the hospital. So you still may not be able to dress yourself, feed yourself, walk, or transfer, but because Medicare classified your procedure that you had as outpatient procedure, you don't receive any type of skilled care. That is on your responsibility. That is on your dime or your family's dime. So it's really, you can't rely on Medicare to cover those expenses for you that way. And then we get to this situation like my father, when it was determined that after his last stroke, he was not going to get any better. He was not going to be able to feed himself anymore. He was not going to be able to communicate and walk and transfer without assistance. At that point, Medicare stops paying 100%. They stop it altogether. When you stop being able to be eligible for skilled rehabilitative care because you're not going to get any better, Medicare stops altogether. And that expense falls upon us at that point. So this solution to having this worry about whether it's going to be paid for by Medicare or not, whether it's only going to be paid for a certain number of days, or what happens to mom, that type of thing, could be a long-term care policy of some sort. It supplements any out of pocket expenses you may have. You can protect those assets that maybe you want to pass down to your family, like land, things of that nature. But most importantly, it gives you 100% control over where you're taken care of and in the manner that you want to be taken care of. You want to stay in your home. You want to have someone come in and take care of you. A good plan can do that for you. Stay connected to those things that matter most through this stay-at-home benefits. A good long-term care plan, and I'm not talking about an insurance policy, I'm talking about a plan, depending upon how you plan, can help you with those in-home tasks that maybe aren't as easy for you to do. A visiting nurse or a home health aide can come out and take care of those things. Give you special equipment that can keep you at home. If it's simply just having an adjustable bed or a lift chair that can get you up the stairs, a good plan can provide you cash to do that. If that's the difference between keeping you at home or taking you to a nursing home, by all means, stay at home. Stay where you want to stay. The thing I love best about good plans is that it provides you the ability to modify your home so that you can stay in your home. Could be adding a wheelchair ramp, widening some doors so that you can fit through easier, putting pool bars or walk-in showers, ways to get up out of the tub, or lowering countertops, things like that. Modifications that can keep you at home. Some plans give you that ability, give you the cash to do that, to stay at home, not to be dependent on someone else. So that's what I love most about those. There are plans that have choices in them with cash or reimbursement. With my father's situation, once we got him squared away in his nursing home facility, the nursing home said it's going to be this much a month. We sent that bill directly and coordinated it with his long-term care provider. And every month, the long-term care provider wrote that check. My stepmother and my brother and I didn't have to worry about anything. Dad was taken care of. Other plans I've seen to where you can have just a lump sum of cash and you can decide what you want to do with it. So again, there's a lot of varieties out there, just the same as there are a lot of varieties of ways to get cared. And there are some other options that are out there. Some people say, you know what, I don't need a 5-year plan. I need a shorter period of time. I maybe want a year's worth of time that I can have care for my mother while we get her affairs in order, while we have a decision to make as a family, that we don't have to rush into something. There are daily benefit amounts that can be larger for a shorter period of time, things that can wipe out your elimination period, things that can keep you at home, that you don't have to go to nursing home. If you can stay focused at home and provide that non-skilled service, what I like to call almost custodial care. Situation with my mother, my brother and I have a plan on her that if she needs to be at home, we can pay to have someone come and just stay with her. And it doesn't have to be someone that's a home health aide, maybe not as expensive. Maybe we can hire somebody from her church that can come in to stay with her, that type of thing. So there are a lot of other options that are out there. And there are some of you who may find yourself in a situation that says, I don't know if I can afford this. I don't know what I can, if I need long-term care or I've got a plan, don't know about it. There are some other unique ways that you can cover long-term care. Some life insurance plans, especially plans that have been taken out in the last 20 years or so, have a provision in there that allow you to accelerate a portion of your face amount benefit, your death benefit, to use in a long-term care situation. So for example, if you have a $200,000 life insurance policy, it may allow you to get 50% or up to 50%, up to $100,000, a certain amount that you can use for long-term care. It doesn't change the fact that your company is only going to pay out $200,000. So once you pass away, whatever wasn't paid out for your long-term care while you were living will be paid to your beneficiaries. This just gives you some money right up front when you need that care. The one thing to look at those policies is usually it only gives coverage if you are in a nursing home. It won't pay for at-home care. So check out, that could be an option that's out there as well. There's another endorsed option through OPEA or OREA, depending upon for a state employer, your retired educator, is a tax-deferred asset protection plan that has the ability to use some of that money for long-term care if you need it. If you need long-term care, you can pull money out of that plan without any penalties, or if you're already starting to receive payments out of that plan, you can double your payment if you have to be confined to a long-term care facility. That's what I have. It protects my family, it protects my wife and I in case we have to have a long-term care need because of my father's health history. Dementia is not difficult. It's not easy for us to qualify. It's really pretty difficult for us to qualify for long-term care. We've got this money set aside that can provide that for us. We've got protection that way. Both of those are strategies if you have health issues, family health issues, or you simply just say, I don't know if I want to pay for long-term care if I don't think I'm going to use it. At least you've got some options out there. As we get older, we're required to take out money from our IRAs, our profit sharing plans, our state savings plans. Some people will use those RMDs and use that required minimum distribution money to pay for long-term care plans. Others, and especially this is a big thing for you active state employees, if you have access, what you do, to health savings accounts, not a flexible spending account, but a health savings account, an HSA, where you can take out money pre-tax, a long-term care premiums are eligible expenses under your HSA. So it means that you can purchase a plan using pre-tax money. The benefits are paid to you tax-free. So you're saving 20, 30% right off the bat that way is an excellent way to pay for long-term care that way. And then we've had other people say, I don't know if I need it, qualify for it, can afford it. They'll take a large lump sum cancer, heart attack, or stroke plan out and use that money to pay for their care if necessary, if they do have a heart attack or a stroke like my father did, to trigger those benefits. So there's a lot of ways that you can take care of long-term care. I appreciate you joining us today on this series. We've got 3 more sessions coming up or actually one right after the turn of the new year. It's hard to believe we're almost at the end of the year. We're going to talk about the 5 major threats to your nest egg on November the 10th and how you can protect that nest egg. Then we're going to talk about some fun stuff on December the 8th about all the free discounts and all the travel savings going into the holidays. And then we'll come back and talk about all the changes to laws and things like that can help you go into the new year in a much better financially healthy state. So please, please, please tell your coworkers about these OPEA webinars, these educational series, help them become involved. As Chanson mentioned, going into this next legislative session, there could be some bills that pop up that we need to have thousands of OPEA members behind in support of these particular situations. We need numbers. Let them know about these educational series and help them become a member of OPEA and learn the benefits of joining OPEA. All right, I'm going to open it up to any questions that you may have here. Please drop those into Q&A and chat. I'm going to stop recording.